I chose bipolar disorder because I believe this is a disorder that we overlook in the American country. There are so many people that may have this disorder, but because they don't have the proper access or funds to be diagnosed correctly by a physician or a psychiatrist, they go unlooked and try to manage without any help. It says that this disorder only affects 2.6% of American adults, which I'm pretty sure is way more in those areas in which it is harder to get the access to these things. Bipolar disorder affects your moods and gives you mood swings. They can put you in a high or a low state of manic or depressive state. What goes on in the manic state is you have more energy, you're more hyperactive, and sometimes you may go too far in the jokes. You show poor judgment and destroy properly if your manic state is too high. You feel you're resilient, you can do anything, possibly jump off of a building, and then you have to suffer the consequences. Most manic states are trigger breaks in your reality, so it affects your conscious mind, and you start to see other things that aren't in your reality. The low state, which is considered depression, is when you come down from that high and you start feeling low and hopeless and that you aren't worth life. Some of these signs that you are in the depressive state is that you lose your appetite, you start increasing your amount of drugs and alcohol, you try to attempt suicide, or you continue to walk away or run away from those family members that care about you, so you damage those relationships. This condition is a lifelong condition. There's not really a treatment for it. It's just things to help you manage and maintain these modes and hopefully bring them down from how frequent they are to less frequent. There are types of bipolar disorder. There are 4, but I'm going to only talk about 2. Bipolar 1 is when you at least have one manic episode, which is a hyperactive episode, and at least one major depressive episode, which is a low episode. Bipolar 2 is when you have 2 low episodes. You have a major depressive episode, and then you have at least one hypomanic episode. So not your more hyperactive episode. You're still in a manic state of mind, but it's still low. And you can kind of maintain and talk yourself through it at that point. This disorder is most likely diagnosed during your physical exam with your physician, a psychiatric assignment if you go see a psychiatrist, and your psychiatrist may ask you to keep a mood chart, a daily chart where you chart how you're feeling that day. And if you have more high days than low days, then maybe we need to consider you getting some treatment for your personality or mood disorder. Some treatment methods that may be used are different types of therapies, such as support groups, people around you that support you and love you and just want to see you do well. Behavioral therapy, where you go see a therapist and they monitor your behavior. Or psychotherapy, which can provide different outcomes for you. Most psychologists may prescribe you medication to help balance your moods and your episodes, make them lower. Or if you're more dangerous and harmful to yourself, then it may be suggested that you're hospitalized until they get you in a maintained state and you're able to be out in the world without harming yourself. Most people are diagnosed with this disorder from their teenage years and early 20s up to their 30s. Children, mostly, it's harder to diagnose children because children, as we know, have mood swings, and you never just know if it's just a mood swing or are they actually having this type of episode that's going on. Some psychological things that happen. You get that euphoric state, which makes you feel a high, and you're in that rush and you want to keep going. Racing thoughts, you can't balance your thoughts all at one time, and you're more hyperactive. You're ready to go, do things, possibly jump out of a plane, just higher states. Some physical things you may notice with this disorder is weight loss, loss of appetite, not really wanting to eat, twitches, and rapid eye blinks. You can find that you're going through your manic state once your brain starts to make you do those rapid eye blinks. And after being in psychology, I realized that psychology is not just for what people say, oh, you're crazy, or, you don't know how to balance your life. Whereas psychology is not what it seems. It made me look more into my own personal mental health issues that I deal with, which is that anxiety, and getting more information about anxiety from the book helps me more maintain my anxiety and bring it down, and actually talk to people who have anxiety and let people know that I have anxiety, so we can help talk each other down from those possible panic attacks and episodes. How I can use the information I've learned in this class in my life. Being a medical assistant, I deal with a bunch of different people throughout the day. And if I know the signs and the symptoms of some things these patients could be going through, I could possibly help them when they're in one of their episodes, or know what's going on so I can better assist the patient come down from their high, help talk them through it, because we get a lot of patients who come in with various different disorders, and I feel we've seen a few with bipolar disorder, and whose other disorders have been heightened because of the current pandemic. So we have to know how to deal with them and help them maintain and keep them calm so we can have a positive visit. I appreciate the class for teaching me and giving me more information about psychology and things that I didn't know. And I hope you enjoy this video. Thank you. Bye-bye.